to another episode of How to Survive Healthcare. I'm Kayla Thompson-Riviere. I'm a registered nurse turned independent patient advocate, here to bring you the best tips and tricks for advocating for yourself and having a positive healthcare experience in our very broken U.S. healthcare system. Please note that this show is not intended to be a replacement for medical advice, but is instead meant to educate and empower you through your healthcare journey. So today I wanted to talk to you about being prepared for an emergency, specifically a medical emergency in which you would need to call 911. When someone is experiencing a true life-threatening medical emergency, time is so precious. And without proper preparation, it can be easy to overlook some details that could cause some delays in a patient's transport to the hospital, which can ultimately create a negative outcome. So today we're going to talk about the things that you should be looking at addressing to help to make a transition during a medical emergency go absolutely as smoothly as possible, so that person gets there as quickly as possible, whether this be preparation for yourself or for a family member. So, first thing that comes to mind when you call 911 is, can emergency medical services find your house? You want to make sure that you have your house numbers on both sides of the mailbox, if at a minimum of 3 inches high. If your mailbox happens to be opposite side of the road of where your house is, perhaps put an arrow on there pointing to where your house, so they're not driving up and down the street trying to figure out where this house is. You also want to make sure that you not just have the numbers not just on the mailbox, but on the house as well. And bigger is better. And make sure that they can be seen not only during the day, but ideally have some sort of a reflective material so that they can be seen at night as well. Another issue that I've run into personally is the house not showing up on the proper location on Google Maps. A lot of times this occurs with newer construction, but it can happen. It happened with my 100-year-old farmhouse. But this is it's pretty easy to go in and remedy. You can actually go into Google Maps onto the address and request an edit, and you can drag and drop the pin to the proper location. So make sure that your address shows up appropriately on all of the major mapping platforms as well. Now, once emergency medical crew gets to your house, can they get to where the person is who needs help? So sometimes, I know, unfortunately, our houses are perhaps not in quite the state of repair that we would want them to be. Sometimes there can be issues that you have that you don't even notice because it's so commonplace to you. Some fire departments will actually do a home safety inspection and be able to point out if you have like a loose stairs tread or a wiggly handrail or something like that. And that would be ideal to get that fixed, again, before an emergency. And for your own safety too, identifying some of these issues can help prevent a trip and fall and prevent you from needing emergency care in the first place. If there are issues with the home that cannot be remedied right now, for instance, if there's a hole in the floorboards or something like that, that's just a major repair that's out of reach. Is there another way that the emergency crew can be routed around or somehow to make it obvious, again, so that nobody who's trying to help you gets injured and delays that transport, but then also to help from you yourself getting injured and having an accident in the home? Lastly, on that note of can they get to the patient, is the person in question, whether this be you or your family member, a bariatric patient? We see more and more that we have patients that are over 400 or 500 pounds, and sometimes that information isn't always disclosed on the 911 call, whether that be from guilt, shame, or embarrassment. But please, if If you know that you or the family member is going to require the assistance of extra personnel to get them out of the house and into the transport vehicle, please say that when you call 911. Because the last thing you would want is for the crew to show up and then now they're standing around waiting on backup, because when they could have had everybody come at the same time. The next thing you should have in place prior to your emergency is where you want to be transported. Now, for a lot of people, typically speaking, the ambulance crew is going to take you to the nearest hospital. But some people, particularly who live in big cities, may have a few different facilities all kind of in the same area. So have your preference for what's your first choice, second choice, and if you can, third choice. But know if you live in a more rural location, that the crew is going to be required to take you to the closest place, whether that be your first choice or not. Also, it is still good though to have an idea in mind of what your preferences would be, because sometimes the closest location may be on divert, meaning that they're not accepting ambulances. So at that point, it may get kicked back to you what your preference would be. So just know where you are and what your options are ahead of time. After you do call for yourself, or more likely for a family member, there's a little bit of a checklist you want to go through and make sure everything is ready for that EMS arrival. So make sure the doors are unlocked and that they can get in, again, with no delay. If you have pets, make sure they're put up. The last thing we want is a very excited dog, going after the ambulance crew. Put them in another room or in a crate if you can be. Same thing with cats. We don't want to be losing any cats or any other pets. If there is an extra person in the household at the time, send them to the road. That can be very helpful, again, especially for some of these more rural areas or newer developments. It can be helpful to have somebody who can flag down the ambulance crew and make sure that there is no issues with them arriving to the proper location. If the person has gotten themselves in a weird position and there's perhaps furniture in the way, do your best to move the furniture out of the way, again, so there's no delays in those providers getting to the patient. You also want to have their gather up their medical information, the medications they're on, the doctors they see. I recommend, if you haven't already, to download my Health Hub tool, keep it up to date, and you can have it printed out. And you can print out multiple copies to make sure that you can pass them off to the ambulance crew and make sure that they get to the healthcare providers at the hospital. And then also, who should go with the patient to the hospital? Sometimes there's a lot of people who live in one house, multi-generational. Does the patient want their spouse to be the person to meet them there? A lot of times there can be some issues with room at the hospital, both physically room in the waiting room or restrictions on the number of people who can be in the room with the patient. So we typically don't recommend that the entire family show up at once, but knowing ahead of time who are the most important spokespeople for that patient and making sure that they are notified and that they know to make their way into which hospital to go to. So some things that you want to avoid if somebody is having a true medical emergency is driving them to the hospital. Being an ER nurse, this is something that I've sadly witnessed many times. Of course, there's times where it's appropriate to drive a person to a hospital. Not everybody needs to ride in an ambulance to a hospital. Actually, we see a lot of times where people have called an ambulance to a hospital and it really would have been more appropriate for them to drive. But if they're having a potentially life-threatening emergency where you suspect a stroke or they're having chest pains or shortness of breath, please don't drive them to the hospital. Even if you think and you may be able to put them in the car and get them to the hospital sooner than EMS could arrive and then pack them up and then get them to the hospital, the difference is that you cannot do anything for them during that drive to the hospital. And I've lost patients because the family members said, "Oh, I can get them to the hospital quicker than 911 can." And while that was true, the patient unfortunately then went into a cardiac arrest in the back of the car. So by the time they got to the hospital, they had no heartbeat, no breathing for who knows how long, and there was no CPR or anything being done during that time. And I've had a few of those instances, and in all cases, we were never able to resuscitate the patient. So please, when there is a life threatening injury, illness, or injury occurring or suspected, please call 911. That is what they are there for. And to let the emergency medical services treat that patient when they arrive to the home and for the duration of the trip. You also don't want to give somebody who's having a medical emergency, don't give them any medication unless you've been instructed to by the 911 operator. It can be potentially dangerous depending on what's going on with that patient, or perhaps interfere or delay their care when they do get to the hospital. You also, this one might seem obvious, but don't leave them alone. Again, their condition could debilitate quickly, and you also want to be able to interact with the emergency medical services and be able to give them a timeline of what's happened. If you leave them alone and they get into a place where they can't speak for themselves, well, then EMS is going to be standing there trying to figure out what's going on, and we're losing that precious time. If you ever have somebody who you suspect a head or a neck injury, for instance, if they fell, don't move them unless where their location is a direct threat to their life. So if they somehow fall near a fire or something, move them and deal with that fire. But for the most part, try to leave them exactly as they are, because moving a person with a head or neck injury without proper support can actually cause the injury to become worse and perhaps have permanent damage. And also, best as you can, don't panic. Help is on the way. And they will get that person to the appropriate place and get them the care that they need. Now, when EMS does arrive, there's going to be a lot of questions. Please be prepared for that. There's going to be a lot of questions too when they get to the hospital, and a lot of redundant questions. And that's not to be annoying. I think in elementary school, we probably all played the telephone game. So if the family tells EMS one thing, and then they drop off the patient in the hospital and they tell the nurse one thing, and then the nurse tells the doctor that thing, little pieces can get lost or shifted over time. So it's always best. That's exactly why every time a new provider comes in the room, they're going to ask the same questions over and over and over. And it's not to be redundant or annoying. It's just to make sure that we're all on the right page and that your story isn't getting messed up by the telephone game, essentially. Also, I can't tell you how many times once a person gets asked the question, 4 or 5 times, they go, "Oh yeah, there was this thing that I forgot to say," and then something else comes up that wasn't shared initially. So be prepared for lots of questions. When you are answering questions for emergency medical personnel, do your best to keep your answers as succinct and as clear as possible. If it doesn't feel like it's relevant to the story for what's happening today, leave it out. They're typically not interested in the patient's entire past medical history unless it's related to today and family history. We really just want to focus on what's going on in this moment, in this emergency. Also be aware that sometimes the people who arrive first are not the ones with the ambulance. There can be paramedics who meet up with the ambulance, or sometimes the fire department will show up first and they're not going to transport you to the hospital, but they're trained to help with some immediate interventions. Also know that emergency medical services most likely is not going to show up, scoop up the patient, and drive away. It takes a little bit more than that. They need to understand what's going on with the patient, assess the patient. Sometimes they'll start an IV or get an EKG, provide them with some rudimentary interventions to help stabilize their medical condition before it's safe to transport them to the hospital. This process can take 20 to 30 minutes sometimes. Sometimes it will be really quick. It just really depends on what is going on with that person, what their needs are at that time, and making sure that EMS is going to make sure that they are minimizing the risk to that patient as much as possible. Now, when they're getting the person all loaded up and they're finally going to the destination, make sure again that that sheet with all of their information, their doctors, their current medications, their past medical history, all of that good stuff, make sure that goes with them. Again, I highly recommend that you download and utilize My Health Hub if you don't have that already. Also want to make sure that they've got their phone and probably a long charger. I think we all know a lot of times ER visits are not short. And as much as the patient is able to, they're going to want to communicate with family. After the patient is loaded up into the ambulance and is leaving, if you're the one going with them to the hospital, before you leave, just take a pause and make sure that the house is secure, that the pets are tended to, you know, if the dog's got to go out, if somebody's got to get fed, and realize that, or if there's kids that need to be dealt with, don't forget about the kids and make those arrangements. And then don't be surprised. Sometimes, depending on what's going on, the patient may not necessarily go to a room in the ER first. So you could actually be meeting up with them at the waiting room. Just know that that's a possibility. As I mentioned before, a lot of times space at the hospital can be limited. So know that, plan accordingly, and also long delays. I've talked before, I have a previous video about preparing for the ER visit itself. You may want to refer to that one with additional items to bring and points to consider. So I hope that this is helpful for you. I know there's a lot that goes into it. Probably you never thought about being prepared for calling 911, but really taking some time to making sure all of these things are addressed, again, can make that emergency go much more smoothly and get the person where they need to be without any delays. So I encourage you to talk to your family about this, identify any areas that you can fix and get a plan in place. You could even put it in place with a checklist so that when this happens, you're not scrambling around trying to recall all these details. If this kind of emergency planning is something you want help with, that's something I can absolutely help you with. Feel free to reach out to me on wherever you're seeing this video, on YouTube or Facebook, or you can go to my website, heardforlife.com/for-patients. So please share this with anybody who it could help, and have a wonderful day.